And what we have three brilliant speakers. So initially we have James Freed from the head of the NHS Digital Academy, talking alongside Nicola Henderson, who's from NHS Forth Valley, who is the AHP Digital Clinical Lead, looking at some more strategic overviews and ideas about how the Digital Academy and other education interventions are supporting different workforces, not always necessarily physiotherapy, but lots of insights there about implementation. And then we will hear from Jackie Lidgard, who's a professional advisor at the CSP, about what the CSP is doing around readiness for the workforce. So we'll get straight into it, each speaker. So we'll first have the first two who'll take about 25 minutes to take us through that overview of what's happening nationwide. And then Jackie will take over, and then we'll have plenty of time for questions. So welcome.
Thanks, Jackie. It's always great to see who turns up to the last session on a Friday afternoon, so well done to you all. So like Jackie said, I'm Nicola Henderson, and I'm actually a dietitian, so it's great to be in a room, in a conference full of physiotherapists, but my role is around digital, and I'm actually here today representing Leslie Holdsworth. A lot of you may know of Leslie, and she's the clinical lead for digital health and care at the Scottish Government. So Leslie asked me to cover for her today, but the great thing is I've got first-hand knowledge of a lot of what we're going to discuss today. I've either been through the programmes, or I've contributed to the content of the programme, or I've facilitated and provided peer support. And I'm really pleased to say that England and Scotland are completely on the same page today. We're in complete agreement about what we need to do to develop a digitally enabled workforce for the NHS. And I'm delighted to be sharing the stage with James. Oh, I forgot I was to click. Do you know, I was so busy seeing that what we're saying is appearing on the screen, great technology, I forgot I had to manually click here to move this on. James.
Thank you very much, Nicola, and a tremendous honour to speak to you today. So I'm James Freed, I run the Digital Academy in the NHS in England, and I'm going to start this talk giving a little bit of a background as to why we're talking about digital skills at all, really. Next slide, please, Nicola. Thank you very much.
Oh, no, we're going to do next slide.
I could nod. I'll nod.
Do you want to hold this?
All right, then. Thank you very much.
We're just going to share the technology, James.
You could have the back button, I could have the forward button. Right, this is a stat we don't talk about very often. Digital transformations fail more often than they succeed. This is not just true for the NHS, it's not just true for healthcare, it's true for all industries everywhere in the world. In fact, a similar sort of percentage of change initiatives, regardless of if they're digital or not, also fail. About a quarter of them fail catastrophically. They achieve less than half of the benefits that they were intended to achieve. If you think about it, this is kind of our lived experience. If you think about using digital technologies at work, just think to yourself, how would I rate that out of 10? Do it. On average, people like you working in the NHS rate digital technologies about 6 out of 10. It's not an awful score, but it is a net detractor score. We, as a population of people, tend to be less positive about digital technologies in the NHS than we are positive. We tend to talk more negatively about them than positively. We also know why digital technologies fail. About 63% of digital technologies that fail because of cultural or skills deficit reasons, not because of choice of technology, not because of lack of money. Choice of technology about 20% of the time contributes to failure. Again, this is actually across all digital transformations in government, in public sector. About 20% of digital transformations fail because of lack of funding, but the other 3/5 are for cultural and educational, well, cultural and skills deficit reasons, things we can address through education. And that's why we think that working in the world of digital education is so important. You know, we can address these sorts of problems. We know that collectively, if we do this well, we might fix a an efficiency gap of about £368 million every single year of digital transformations that promised something but failed for some reason. We also know that digital transformations, when they go wrong, or actually even sometimes when they go in inverted commas right, can cause harm. Sometimes that harm is clinical, sometimes it's about patient safety, sometimes it's around staff burnout. We know that the worst electronic patient record implementations contribute to staff burnout about as much as COVID did. Just let that sink in for a second. Digital transformation, if we do it badly, is extremely harmful. So if we can train people to not fail, or I might prefer the word succeed, then we will make a big difference. I hope you'll agree. That's why what Nicola and I are about to talk about is important. That's the reason we do what we're doing. So what I'm going to show you now is the outcome of some of the work we did in England. We produced something called a logic model, a model of change. And then Nicola's going to show you the logic model for Scotland. There are some differences, but the conclusion I want you to draw... Actually, you know what? I'm going to let Nicola tell you the conclusion that I'm hoping that you'll draw after you see this. The work that we did in England was based on a learning needs analysis we conducted across the whole of the NHS. We were asking people where their biggest problems were with digital and then who needed to do what or know what in order to fix that problem. It helped us really understand our two core problems in the NHS, and that is that people tell us that they don't know how to use the technologies they've been asked to use on a day-to-day basis. They also tell us that the technologies they've been asked to use on a day-to-day basis are fundamentally unusable or unavailable. Now, clearly, I'm over-egging the pudding a little bit. They're the two problems that are presented, and clearly not all technologies are people don't know how to use or are unusable. But nonetheless, these are our two core problems. What that means is, and our learning needs analysis demonstrated, was that there were different communities that we need to reach through our education to help address those two issues: senior leaders, educators, all staff, and indeed digital data and technology professionals and budget holders. Nicola, what's your logic model looking like?
Well, it's great to see that in Scotland, our logic model is very similar to England. Of course, we use different words in Scotland, but the key message is the same. We know what we must get right, and that is very similar to what we've got in England here. As you all know, we need an NHS that provides and supports safe, effective and efficient care. You'll all know that, but what's important is that we can do that in this digital world. Now, we need that workforce to have the capability and the confidence to use data and information and technology to transform services. So what we have in our logic model is 8 elements that we must get right, and I'm sure these elements will be familiar to you one way or another. In Scotland, we have tailored various delivery plans to meet the needs or to provide these elements and to make sure that we get it right. And we're focusing on the entire workforce. This isn't just something that's at senior level, it's about the entire workforce in Scotland. And it includes the most senior leaders, including the executives in our organisations, but it's at all levels. We need to make sure that our workforce has the right skills, the digital tools and the capabilities and knowledge to enable them to carry out their roles in the best way. So James and I are going to look at 6 different staff groups today. These are the staff groups that we're trying to address in terms of digital skills and competencies. Now, all of you today are in the all staff group. A lot of you may be in the middle managers staff group. Now, we see middle managers as being experienced Band 7s and 8As and above. It's really people that have got responsibility for service redesign and being able to think about how to use technology within the way your services run. We're also looking at senior digital leaders as well as board level leaders, and the board level leaders tend to be non-digital people. We want to look at the digital and data specialist workforce as well as our educators. So let's have a look at all staff first. Now, all staff is anyone employed in health and care organisations that is being asked to use or would benefit from using digital technologies and data. Now, the estimated workforce size across NHS England and Scotland is 1.58 million people. That's a huge number of people. But the problem is 63% of healthcare staff cannot undertake all 20 essential digital skills for work. So when you think of what 63% is of 1.8 million, that's too hard on a Friday afternoon, but it's a lot of people. So this is a concern. So what are we doing about this? Well, we are using a digital and data capability framework to help support our knowledge of what we need. Before we undertake the development of any education programmes, we need to know where our gaps are and where our skills and strengths are in terms of the workforce and digital capability and competencies. So just fairly recently, at the end of July this year, Scotland produced this digital and data capability framework. There's a self-assessment questionnaire that goes along with this. Now, there are 6 capability areas that you can see on this screen here, and then staff are ranked in terms of 3 different levels, from either basic or lacking in knowledge to expert capability. So ideally, we want the majority of our workforce to complete this self-assessment, and that will help the staff, their managers and their organisation understand where are our strengths and where are our gaps. Ideally, we would like this done by all staff on induction so that we've got that baseline of new staff coming into our organisation so we can understand what they need to be able to progress in their roles in terms of digital and data, but also so we know where the strengths are so we can make sure that our organisations use these strengths. Now, to support staff, we've got a number of different resources available in NHS Scotland, and that's available to the full health and social care workforce across Scotland. The resources are available through NHS Education for Scotland, which is NES. For example, we've got this digital and data resource hub. That is jam-packed full of resources, huge wide range of resources and activities that have been aligned to the capability framework. So if you complete the capability framework and you address some gaps in your knowledge, the resource hub will help you find the resources and activities that will meet the gap for you. The resources are free of charge through our national education platform, which is known as TURAS. We've also got a Microsoft 365 Skills Hub, which has a range of how-to guides, as well as lots of webinars to support people's learning. We have a Digital Champions Network in Scotland. Now, that's open to all staff at all levels, and it's there to support organisations to develop their local Digital Champions Network. And really that's then supporting the development of digital skills in the workforce at all levels. And that's really important to us because we want it at all levels, not just senior levels. James, what have you got for all staff?
Oh, thank you very much. Very similar products. So as well as Scotland having a framework, England also has a framework around digital capabilities. They're very, very similar. Not the same, but they are very, very similar. If you use either, actually, you're going to get a very similar outcome. There's also a digital self-assessment tool that every single trust in the country and a number of social care providers as well are signed up to using, which enables individuals to assess themselves against those skills. And similar to how Nicola's described, you get signposted to a subset of 280 free, bite-sized usually, bits of learning that help address the gaps that you have personally. Something that we do also have is we've witnessed a proliferation of people trying to solve the same problem. So individual organisations have also developed their own frameworks and their own self-assessment tools, as indeed have some professions. Royal College of Psychiatry has developed its own framework. There are similarities, there are some differences as well. And the UK government has also developed something called the Essential Digital Skills for Work framework that Nicola mentioned earlier. That demonstrates that the NHS workforce, in comparison to the UK workforce, is less digitally literate. About 63% of the NHS workforce can't do all 20 digital skills for work. About 5%, about 1 in 20, can't do any. That means they can't use a computer to access learning, which means that if we are delivering our education through a computer screen, we're immediately preventing about 1 in 20 people from accessing that learning. It means that we are going to have to be collaborating much more with learning and development professionals in organisations themselves, where digital literacy is often, or digital literacy issues is often associated as well with other literacy and numeracy deficits. Let's go on to the second group, middle managers. So this is a large population with a very big error margin there, 100,000 to 500,000 we're estimating. This is based on wider industry stating that 41% of a given workforce are what's known as business technologists, people who are using technology as part of the delivery of their services but are not digital professionals and not working in the digital department. Increasingly, consumer technologies are available to us, and we start using those in our work patterns. Things like generative AI are things that we are starting to use more. Some people are scared about it, some people are using it, there are risks, and we don't necessarily know what they are. This group of people are starting to use technologies, but don't necessarily understand the risks associated. And we think that it's this group of people who are contributing to our clinical staff, saying that they've got to log on to, on average, 11 different systems, each one taking between 2 minutes and 20 minutes to log on to, resulting in significant amounts of stress, retention issues, burnout, and indeed patient safety concerns. So it's important for us to reach these people, is what I'm saying. In England, we've got a number of things that we're offering. I wouldn't say it's comprehensive as yet, but it's things like addressing user-centered design. So when you're thinking about digital technology, start with your users' needs first. How do you do that, and who do you need to talk to, and how do you make sure that you're offering a service rather than just buying a digital product? We've been working with certain professions, in particular the finance profession. The HFMA is their professional body, to develop e-learning to support them. And we have been working in collaboration with the Chartered Society of Physiotherapists to develop an introduction to clinical informatics, which is still in development, but we're hoping will go live soon, and in fact will be delivered across both Scotland and England.
Thanks, James. In Scotland, we've also recognised the importance of the middle managers group of staff. And in 2013, Scotland launched its first digital health and care digital leadership programme, known as the DLP. It focused originally on the NMAP community, so nurses, midwives and allied health professions. We make up about 73% of the workforce in Scotland, so we're a big workforce. I was in cohort 1 of the DLP, and a lot of you'll know Ewan McComsky, who's here today in the front. Ewan and I were both on cohort 1 together, and the DLP has been a great springboard for the two of us in terms of our digital AHP careers. We often look back on our photos, don't we, Ewan, from cohort 1, when we were a bit more baby-faced. But it was great to start a course like this when we were all wanting to explore the world of digital in the workforce, and now see how this course is now evolved and expanded. It's now open to all professions, it's no longer just NMAPs, and the content has changed hugely as well. Participants complete a digital leadership or digital improvement project, because the course runs over 8 months, so they've got a good length of time to really put a project into play and get outcomes from it. We've had several hundred people go through this course, so that's many digital improvement projects that have occurred in organisations across Scotland. And the demand, though, for a place on this course is really high. We've just launched the advert for cohort 25 now, and last time there was 5 applicants for every 1 place. So although we've got this fabulous programme, we've just not got enough space for everyone to get on it. So to recognise the fact that we've still got lots of staff out there that want to learn and improve their digital leadership skills, we also run a digital leadership webinar series. It runs approximately once a month. The content is driven by requests from staff. So if staff across Scotland want to know about a particular topic, they can request a webinar on it, and we will find subject matter experts to deliver that training, which is great. It's a great way of shaping training according to what you want. These webinars are very popular. So if we move on to board level staff, in our annual delivery plans in Scotland, we have stated that there is a need to develop the digital knowledge of people that are sitting round board tables. Those people at board level, they're the ones that are setting the tone of the culture within an organisation, as well as setting the tone as to how much risk that organisation is willing to take. And we need board members to be open to digital transformation and innovation. The problem is we need them to do this quickly because, as you know, technology is changing rapidly and we need to keep up with that. So what we've done is we've developed a programme specifically for our board executives, non-executives and trustees. And the aim of the programme is to build their confidence and their knowledge to lead and govern and support organisations to transform themselves in this digital world. One part of this programme is called the Digital Mindset Programme. Have a think just now about what your digital mindset is. The purpose of this session with board level members is to really get them to understand what the digital thinking is that they need to have that then leads to successful digital transformation. So our sessions are designed to empower these board level leaders to set and deliver strategies that will consider and implement new ways of working. And we're really wanting the board level members to be thinking about what's the benefit of existing technology as well as emerging technologies. So the concept is more around digital being that user-centred, collaborative way of working, and the technology itself is just that enabler to do that. So James, what's happening in England for your board members?
Thank you very much. So something very similar. Although we've got different programmes funded in different routes, both England and Scotland collaborated on things like the curriculum for this. So I'm not going to talk about the reason for it. Nicola's done an amazing job. But we've got two broad products in England, one of which is aimed at boards of trusts. The other one is aimed at boards of ICBs. So it captures slightly different groups, slightly different routes. Same fundamental tenets, same fundamental curriculum. The little diagram on the left, the blue circle is a measure of capabilities, board-reported capabilities before and after these sessions. We can demonstrate we're making a difference on board-reported ability on all of the 8 elements of digital leadership in our framework. And we're building up those measures of ultimate impact and outcome, which takes longer to measure. Coverage at the moment is pretty good. About half of the trust boards in England have undertaken one of our sessions. About a quarter of the ICBs, the integrated care boards, have been through one of our sessions. I describe these sessions, though, as a door, which some boards choose to walk through after these sessions. They're about 2.5 hours to 4 hours long. You're not going to get fundamental, deep learning in that sort of amount of time. You're going to get a bit of mindset shift. So we help boards on with that mindset shift, thinking about how they run organisations in a more digital way, a more 21st century way, and how they make those decisions around big digital investments better. The next community is senior digital leaders. So these are the people who tend to have a chief in the title. They're not necessarily. They're organisation spanning in their responsibility. It's people like chief information officers, chief clinical information officers, chief data officers. And they are the digital acumen, if not necessarily on the board or the executive, somewhere close to it. And they've got an overall responsibility for an organisation's digital direction and digital strategy. If you've got a good person in this post, it means you're going to make the right decisions in the right way more quickly, you're going to cause less harm. If you've got the wrong person, they can be a tremendous blocker to innovation. They can make the wrong decisions and they can cause more harm than they alleviate. So this is a very important group. We estimate it's a relatively small group, about 1,000 people across both England and Scotland, and we have some products to try and address it. The big product we've got in England is something called the Digital Health Leadership Programme. It's in its 7th year. It's delivered by Imperial. It's a postgraduate diploma, a year-long course that people spend between 10 and 20 hours a week for a year on. This is in-depth stuff. We just started our 7th cohort. This is, I think it's cohort 6 in York. And some people in the audience may even have been on it. Certainly, we have. And we've learned from it. One of the downsides of this is that at the moment, that content is for those 100 people. And so one of the things we're trying to do in England is render that much more open and bite-sized so that anyone can get access to this education at any point. It's taxpayer funded and it should be free at point of delivery to healthcare professionals. Nicola.
Thanks. When this programme was launched a few years ago, there was a lot of excitement about it for the NHS Digital Academy. Scotland doesn't like to miss out, so the Scottish Government sent some people to the NHS Digital Academy programme, and I was one of the lucky people to be on cohort 2 of it, and it was an absolutely brilliant opportunity. It was really good. But now Scotland have their own version of this. So we launched this in March 2023, and it's delivered by the University of Edinburgh. It's very similar. It's aimed at current and aspiring digital leaders. It's really people that are out there wanting to drive, deliver and embed digital transformation in their organisation. At the first cohort last year, we had about 48 people, 48 participants, and they spanned over 32 organisations in Scotland. So it means we're really spreading the word and the work out across Scotland. And the cohort represented 19 different professions, which was great. And half of them had already completed the digital leadership programme that I mentioned. So that shows a nice transition of doing that initial programme, that course, and then moving on to a postgraduate master's level programme. So if we move now onto the digital and data specialist workforce, we estimate there's about 45,000 people as part of this workforce, and that's clinical and non-clinical. But one of the problems here is we need to ensure this workforce have the right skills and that they're in the right place in order to make a difference to organisations. So in Scotland, the way we're supporting this group of staff is through the KIND network. So this is a learning network for the knowledge, information and data workforce, but it's also there for people like yourselves, clinical people who are interested in building their skills and expertise in these areas. It's hosted on Microsoft Teams, and there's a wide range of activities that take place, and the activities are driven by the members. It includes training that you can attend, but also there's a lot of self-paced training as well, which is great. And there's some example there on the slides. James, what have you got for that workforce?
Thank you very much. So one of the things we've got, I'm going to start at the bottom actually, the Digital Skills Development Networks, that's what DSD stands for. We've got 8 now regional networks who deliver skills to support digital professionals to develop, but also generalists to develop digital skills. In 22-23, which is the last full year of data that we've got, they trained 3,500 people in 600 different skill sets. It's a tremendous breadth. They also did our first census, which identified that we have got about 38,000 digital data professionals in the NHS in England, and some real deficits. Out of 38,000, we've only got 9 user researchers, for instance. You know, no wonder we don't necessarily have the most usable technologies in the world. We've also recognised that we've got about 80 different professions, whilst also simultaneously having 19,000 different job titles. Let that sink in for a second in the digital and data community. And we're going to, over the next couple of years, see a lot more consolidation onto a smaller number of job titles, which means we're able to provide career structure and also development in a much more structured way and supportive way. So you're physiotherapists, you're used to that level of structure. But for those of us who are non-clinical, it's a bit of a wild west in terms of what job you are and what career structure that you've got. We've got 3 other products that I want to mention here. The Topple Fellowship is a year-long program aimed at clinical and non-clinical service owners in training, basically. We've got a program around supporting project managers develop product management skills, and we're supporting data analysts through a modelling associate program, which is actually a 15-month program. But as you can see, there are 3 out of 81 job titles. We've got quite a lot of work in this space to try and make sure we've got a comprehensive learning offer for digital and data staff. Finally, the last little group is educators. We've got somewhere between 1.2 to 3,000 people working in the NHS across England and Scotland whose job is to support others develop digital skills. Our learning needs analysis at the beginning of the year indicated that these people don't know how to support digital skills development. They use the words in the dark and at sea. That's their words, not mine. And we need to support them better, both to understand how to use digital in education, but also how to develop their own digital skills so that they're able to address these sorts of issues more easily. The things they've asked for is digital champions networks, how to set those up, train the trainer programs, and things like templates for digital learning and development strategies. They want to do this work, they just need some help. At the moment, neither England nor Scotland have got formalised training programmes in this area, so it's definitely an area of growth for us. Nicola.
Thank you. So that's our 6 groups of staff that we wanted to run through, and hopefully James and I have shown that across England and Scotland we've got a lot of similar work that is going on to really develop the entire workforce in terms of their digital skills, knowledge and capabilities. Now, what we're doing is very similar, which is great and reassuring, and we also know, I should say, that there's lots of great work going on in Northern Ireland and Wales, and we're going to hear from Northern Ireland in a minute. However, we know that we could do so much better if we all work together as 4 nations. For example, developing shared library of resources, developing this training that's open to all. And actually the CSP are a really good example of that, because you already mentioned, James, they're currently developing informatic training for AHPs across the whole of the UK. And this is what we need to see more of, so that you're all able to access everything in the same way. And we want to work more closely together.
We do.
Even though there might be a bit of competition, we want to work more closely together. That's because James and I have just been doing the grip strength out there to see who was the strongest. We won't say. So, for taking away from today, because I know it's Friday afternoon and you need to think, what do you need to reflect on from this session, from us two? We really want you to start thinking about your own digital mindset. What do you think about digital data technology in the workplace? What are your own digital skills like? How can you develop yourself and the teams that you're working with to really transform that service using the digital and data that's out there? So we are going to have an opportunity for questions later. However, what I have done is we've got our contact details up here, including QR codes for you to contact either one of us. So if you don't get a chance, or if you don't want to ask a particular question in here, either catch us at the end before you run away for your train. I'm staying for the party.
Very good.
And otherwise, you can contact us if you've got any questions. Thanks very much. Well done for staying on a Friday afternoon. And over to Ireland, is it? It's like the Eurovision Song Contest. We're going to call Ireland now. Yeah.
Thank you.
Just want to thank our speakers while we're waiting for you to do a tech review. But I suppose in prep for a Q&A session, from a falsely naive point of view, understandably, I wondered if all the speakers could try and maybe construct an answer to what do you mean by digital, just as a pondering, because it's quite an expansive idea.
Hi everyone, my name is Pippa McCabe and I'm the Chief AHP Information Officer in the South Eastern Trust in Northern Ireland. I'm going to give you a little bit of context about where we are with digital health in Northern Ireland. We have 6 health and social care trusts made up of 5 geographical areas: Northern, Southern, Western, South Eastern and Belfast trusts, as well as NIAS, the Northern Ireland Ambulance Service that covers the whole country. As a nation, we're currently midway through the implementation of one electronic patient care record using Epic software across the 5 geographical integrated health and social care trusts. This covers both physical and mental health in all acute and community settings and provides primary care access to the record through Epic Care Link. We call this system Encompass, and through the implementation of Encompass, there are now Chief AHP Information Officers like myself in each of the trusts, even though we're in temporary roles for the moment. The rollout of the implementation has been sequential, with SET going live last November, Belfast in June, Northern due to go live next month, and Southern and Western next May. This process has been an immensely steep learning curve for us as CHPIOs and for staff on the ground, as large numbers of AHPs in Northern Ireland were still paper-based or only partially using electronic systems for activity and documentation. Our aim is by 2025 that all health and social care employed AHPs should be paper-free and have access to the digital tools that they need for their roles. However, giving staff the the tools to do this obviously does not guarantee success. And in December 2022, we launched an all-Ireland digital capability framework with our colleagues in the Republic of Ireland, as we are still working towards embedding this into practice and using it as a driver to develop digital education for healthcare professionals across Ireland. Our Chief AHP Officer, Michelle Tennyson, recently reinstated an advisory committee for allied health professions in the Department of Health, and digital health is one of the 10 subcommittees sitting underneath that. As chair of that subcommittee, I'm really looking forward to focusing on some key priorities. Firstly, the importance of dedicated clinical informatics teams in the ongoing development of our use of Encompass through training, quality improvement, issue management, data quality reporting and support to staff. Secondly, a refocusing on the digital capability framework to provide baseline data and direct future education commissioning. And lastly, by exploring a central digital repository for AHP health messaging for the public of Northern Ireland. There's a lot to do, but it's really exciting space to be working in. Please do get in touch if you want to find out more about what we're doing here. Thank you.
And thanks, Pippa.
Thank you. I am your second Jackie of the afternoon, and I'm so sure that I am actually going to have to move this microphone down, otherwise you will never hear me. And apologies to anyone from Wales that I'm not Welsh, so you can't complete your Four Nations bingo card. Hopefully you've seen a Welsh speaker somewhere else in the day to complete that. So, like it says on the slide, my name is Jackie Lugard. I'm a professional advisor from the CSP and part of the health informatics team. I'm going to talk a little bit today about what the CSP is going to bring to this space and what our role in all of this is. Hopefully this will work. So what is the dream for informatics in physiotherapy? Is it for us to have amazingly technologically advanced physio environments where a person has their gait assessed as they walk down the corridor to their appointment and you sit down to speak to them and all of that information is uploaded, ready for you to read? Is it for us to work alongside physio robots who can simultaneously take an ECG, X-ray a patient's knee and transcribe your conversation and upload it to the electronic patient record without any privacy or data concerns? And wouldn't it be great if you could actually look at that transcription and know that it was 100% accurate and you didn't have to go back and look at it and try and decipher what on earth you actually said to each other? So what do you think? Have a little moment to think about how far away we are from that as a profession. Although I have seen some fancy tech, so some of it isn't probably, totally pie in the sky. And just for interest, I asked an AI generator to create this picture for me, and judging by the amount of tries that it took to get an anatomically accurate knee, I think we probably are a little bit away from it. I should have had a montage of some of the outtakes because the three-legged and the bones that the AI generator came up with was actually really interesting. So as you've probably all had a thought to yourself, the reality actually is somewhat different. We know that there's definitely pockets of excellence and there's services using great technology for treatment, assessment and evaluation. Some of them have been talking today and hopefully you've had a chance to look at them and see what they've been up to. But we know that there's some huge gaps. We know that our systems don't support us and that we know that there's equipment and connectivity issues at a really, really basic level. Most of you here, I'm sure, will have had times that your notes have dropped out in the middle of writing something and it's really frustrating, or that you've been asked to work, I'm getting some nods, you've been asked to work away from your base and your laptop doesn't connect because you're in a different location. Some of the systems we have are really, really clunky and they're not intuitive to use. And compared to the technology that we use every day for our shopping, for our entertainment, they really feel outdated. We also know that not everybody, James and Nicola have already alluded to it and given us some great statistics, that not everybody has the skills to use or to understand technology. And that's across the board. That's healthcare staff, that's patients. And we know that we're time poor. We know there's a lot of pressure and that having the time in a really busy working day to develop those skills is very, very difficult for people. I'm also aware of the irony of having paper notes, by the way, doing a tech talk. I'm going to talk about data in a couple of slides, but as a profession, we know that it's something that we're really poor at using. We're not collecting it, we're not using it, and we're not sharing it as well as we could in a way that benefits us. So, what is the CSP doing about all of this, you ask? We've done quite a bit of work so far, and to help address some of these gaps, we developed the Physiotherapy Health Informatics Strategy. So it was launched back in 2022. And it grew from quite a few things. So it grew from government policy. We know that there is a real drive on a national level to get informatics, that James and Nicola have talked about, get informatics and technology into practice. We also heard from you guys as members and with your insight that you're finding it difficult and that you need some support to be able to do that. So government policy coming from the top down, membership insight coming from the bottom up, we were able to develop a 5-year strategy to help bring informatics into physiotherapy practice. The team carried out a really comprehensive literature review, which there's bits about that on the website, to make sure that the strategy was evidence-based, and it formed the basis of the 3 outcomes that you can see on the slide. So, first outcome, in the pretty pink, was our vision. And our vision is, I think, is really simple. Hopefully it's really simple for you guys as well. Is that the physiotherapy profession should be using informatics where you're able to improve efficiency, optimize service delivery, and to improve the outcomes of patients. It's not a prescriptive vision, because what we know is that the variation between services and between what physiotherapists do is absolutely infinite. We can't prescribe what is best for your service. You guys are all the experts in your own teams, in your own treatments, in your own skills, and you're going to know what informatics you need. At the CSP, we don't know that. We just want to help you to be able to find out. So yeah, it's essentially being able to use it for whatever is best for your service and the populations and the people that you will work with. Okay, and the second one in the nice yellow is education. So we started to develop the bones of an informatics education program for physiotherapists. This wasn't to teach physios how to code or to how to be able to use AI in practice, and it wasn't about teaching those digital leaders or those people who are at the top in informatics. As you've heard earlier, there's already lots of programs for those people who are there at a higher level. What our program was and what it wants to be is about teaching everybody the basics. So it's about bringing up those core skills. And that's for everybody, whether that's support workers, whether that's qualified physios, or whether that is students. We know there's been quite a lot of research carried out from the people who developed the AHP Digital Competency Framework. So there are tons of digital competency frameworks if you want to look for them. But physios have really low confidence and really low competence in using informatics in practice. However, the great thing that we do have as a profession is that our motivation, and the evidence is there, that our motivation is really high to want to learn and want to develop. So we know that you guys are keen, we know that you're struggling, but we know that you want to change, and we want to help you be able to change your practice. What we did find, though, from going out and talking to people about this education was that actually there's not a need for this just across physios, that the need is there for all AHPs to be able to do the same. And that's when we applied for some funding. Thank you, James. We're given the funding from NHS England to develop these modules into an actual content. So we worked with Keele University and 13 of the other 14 allied health professionals to develop a raw content of informatics education for allied health professionals. We've also applied for a second round of funding to be able to develop these into online interactive modules, and we're going to find out in a couple of weeks if we have been successful with that. If all of that goes to plan, they should be launched in summer 2025, so keep an eye on CSP social media or AHP social media, or just open your Frontline magazine because it will be in there, and we'll be letting everybody know how and where you can access those modules. Oh, the last thing on the list is practical application. It shouldn't be grey, it should be a nice, bright, exciting colour. So by practical application, what we actually mean is how this applies in real-world clinical practice. As I've said before, we know that how people apply informatics is going to be really, really variable. What we want to do is to be able to produce resources that support and guide you to whatever good looks like for you. So part of the things that we're developing, there's obviously lots of things that are a little bit more generic, but is a physio-specific self-assessment checklist, and that's going to be for individuals and for teams, so that you can go through and have a look, and it will help you shape what your learning needs are, either as an individual physio or as a team, and then the resource will signpost you to things that are going to help you, so help you learn, help you in the right direction. There's been so much stuff talked about today that we know sometimes even looking at that can be a bit overwhelming, so it will guide you to the resources that support with your individual and with your team learning needs. We're also launching a networking community so that people can access peer support, share your successes and share your challenges. I'm going to shamelessly plug it, so if anybody is here tomorrow, it's at 2:00 in the networking zone, and it would be absolutely amazing to see you there. So come along, have a chat, meet with other people who are keen to talk at all things digital and informatics, and come along and meet the team there as well, because we'll all be there to say hi. So what are we doing and where are we heading as a profession? We want informatics to be something that runs through the whole of physiotherapy, not something that you think of as a separate entity. That's why there's that big circle around there. So developing an informatics culture is what is really key. You can have all the technology in the world, but what you need to have is the people. You need to have the people who are on board with it, you need to have the people with the skills to use it, and you need to give those people the opportunity to use it, and to use it well. So on an individual level, we talked about it, we want you to have the skills, and we want you to be able to bring it into practice. At an organisational level, so taking that a bit wider, we talked about the problems with equipment and connectivity. We want you to have the right infrastructure so that informatics helps and not hinders your practice. I hadn't heard that COVID statistic. That's actually quite scary in that how much bad technology can impact on your well-being as healthcare staff. That's quite sobering as a professional to think how much it can impact your day-to-day life. So we want that to be able to work for you. We also want people to be able to have the opportunity to do new and innovative things and to try different ways. So we want organisations to think about technology and think about informatics as being a good thing. And for you as physios to think about it in a positive way and to think, we'll try it. I think if anyone went to Pritesh Mistri's talk earlier, he said, don't let perfect be the enemy of good. We want you to just have a go with stuff and see how it might help your practice. And we also want organisations to see the value of investing in informatics. We know you need to have the funding to back these things up. At a national level, the CSP does quite a lot of influencing work. You and our health informatics lead has been on some Westminster roundtables. We're going to really continue to fight for informatics to be part of health policy. We know if it's written at that level that then boards, trusts, services are on board with it. So we're going to be really pushing for it to be part of policy to give you guys some ammunition and some evidence to be able to get the change that you need. We also need to know that there's research and there's evidence that shows that it benefits physio, and Matt, our head of research, will be nodding there because we know evidence-based is what physios are, so we want that to be part of your practice. Cool, and we get to the middle of the picture. So central to all of this, we want informatics to be part of physiotherapy from the very, very start. So we want it to be taught at undergraduate level, and we want it to be inclusive for everybody and not to increase inequities that already exist in populations. So we want physios to come into the profession with that capability, with that understanding and being able to use informatics, and also to understand it. What we don't want, if anybody went to the earlier talk, is digital exclusion. We want people to be able to use it to support people and to bring it into their technology. We also need the leaders, so those people on those programs that we talked about earlier, we want physios to be part of those programs. There have been physios in Topol fellowships, there have been physios on lots of the digital leader programs. We want more of you guys. So there's going to be people here who are only ever going to use informatics at a clinical level, but there's going to be people here and you're going to think, I want to do that. I want to be a digital leader. We want physios to embrace that. You easily have the skills, you easily have the knowledge, and you easily have the ability to take a step. So if you've never thought about it as a career, think about it as a physio. You've definitely got the ability to be able to do that. Okay. So I said I would come back to data. We really, really need to think differently about data as a profession. And this is going to be my take-home message, which is in the middle of my talk rather than at the end, so apologies for that. But if you take nothing else from this talk, I want you really to think about the data that your service collects and how you use it as a team. Do you even use it? Are some of you submitting data that goes off into the ether and you never ever see it again? Do you know where it ends up? Do you know whose hands it ends up in, and do you know what they do with it? Can you confidently say, all of you, that the data that you've got shows the unique benefits of you as a physio or of your service? I'm getting some nods, this is great. And I'm also getting some smiles and some people thinking, not 100% sure about that. We want you to think about data differently. So can you show that your service saves money across a patient pathway? If you're working in an MSK service and you issue fit notes and you see patients from the start to the end of their journey, can your data show the time and the money that you save GP services in your area and the impact that you have on those? Can you show the economic impact that you've got as physios for getting patients back to work? We know that physio-issued fit notes actually have a shorter time frame than those issued by other professionals. Are you looking into that within your service, or are you just collecting waiting list times and DNA rates because that's what you've always collected and that's what you've always done? So yeah, have a think. We have to collect data and we have to use it in a way that evidences and supports the value of physiotherapy. And it might not be the data that you think you need to collect. So think wider than your service. Think about other services you might impact. And the other thing that we need to think is about it being wider than numbers. Numbers and stats are absolutely great and they're fantastic, but really think about that bigger picture. Think about that qualitative, that human side. So if you're building a business case, are you including some patient stories? Are you including some quotes? Are you including some staff viewpoints? Can you show a patient journey alongside your statistics? If you can, and you can use that data to build that big picture and to tell that story with the people in your services, your patients, your staff as the main characters, that's going to create a really, really powerful picture in a way that numbers just can't. And I don't know if any of you came to Kate Tamtam's talk this morning or to the paediatric pain talk, but there were some absolutely fantastic patient stories. I was sat over there as the online moderator thinking, I hope nobody asks me to say a question because actually I need to compose myself. So it can be really, really powerful. It can show that human element of what you do alongside that data element. So this slide should bring us back to the education modules. These are the domains that we're talking about, and these are the ones that make up the modules. I'll just ping through them quickly. Okay, as we said, like with most things, these are all online now, and they're going to be online modules, and they are actually going to be bite-sized. So you don't need to do them all at once. They're like pick and mix. You can go in and you can pick and choose which modules you want to do. You can dip in and out of them. You don't have to start at the beginning. You don't have to finish at the end. If it looks a little bit overwhelming and you think, I don't even know where to start here, then what we're also doing is developing personas to go alongside the modules. And these are examples of different people who are working in physio and how the different parts of the program would support their development. So we're really hoping that you guys would see yourselves in these personas and use them to guide you through the modules. So we've got a support worker persona, a service lead, a newly qualified clinician, and a clinician doing a service improvement project. So it will help to guide you, it will hold your hand and show you what modules might help you. The other thing that we're doing is also using real-life case studies as part of the learning to give examples of how it can be applied in clinical practice. Okay, so last slide. Thinking about the future and really what does it hold? I'm quite old, I've been a physio a long time, but I still even think in my lifetime, I don't think technology and informatics is going to completely replace a physio. But what I do think and what I do know really is that a physio who utilises technology and informatics in their practice is going to have more opportunity and better outcomes than one who doesn't. Technology is never, ever going to replace the human factor of what we do as physios. We pick up really subtle signs in our patients that an AI bot is unlikely to. So if you're asking a question and you get that slight hesitation from a patient or you get that change of expression, we've got that human touch and that human intuition. You can delve a little deeper. You can ask patient questions. It might lead to a safeguarding referral, or it might just lead to you reassuring a patient about something they're worried about. So I don't think it's ever going to be one or the other. What we need to do as a profession is work together with technology to improve our patients' lives. We do want the future to have loads of that fancy stuff, so all of the technology, and there's lots. If you're here tomorrow, go and have a look. There's the air gravity, there's some force plates, there's some funky stuff. So we want you to have loads of the fancy stuff, the VR, the exoskeleton. And we know that's not going to be there everywhere, but we want all patients who would benefit from it to have access to it. But what we also want, and what we really need, is the less showy part of the slide. We want the technology that works all day, every day, wherever you are. We want you to be able to collect, use, and share data that's right for your service, and it shows the benefits of your service and your work. And we know that informatics needs to be across the 4 pillars of physio. So if you don't know what they are, I'll give you a quick reminder. It's education, research, leadership, and clinical practice. It needs to be across all of those 4 pillars. And for you guys as physios, we want you to be involved in the digital change, to be co-producing services. We know if you're involved, you can give great opinions and make services better, but you need to be there from the start to be able to do this. So the technology is there. It's there for physios to adapt. It's there for physios to develop. But it's going to be people who drive the change. It's going to be you guys on the ground that are making the difference, driving the change, wanting to be part of it. And we want the CSP informatics strategy to be at the centre of helping and supporting you to do that.
Thank you so much to all our speakers. I thought that was a really insightful overview, because I, for one, was not aware, for example, that there were such clear pathways for different aspects of digital workforce type of careers. I myself am a Topple Digital Fellow. It's probably one of the reasons I'm standing here today, because though I'm not an informatician, I certainly use data, information in all my work as a clinician and a researcher. So I'm going to probably take chair's prerogative and turn to our panel. So really interested in your questions, ideally not really long comments, if we can save those for the panel afterwards. But if we can hear from comments, do we have an online presence as well? That would be great. Do we have a microphone? Oh, it's a box. Thank you very much. So if you just let yourself be known to Ewan while I ask the panel, we're really interested in this idea of collaboration and how people can do that across digital interfaces, perhaps speaking about interoperability, tech that doesn't work. We're all in different organizations. Some people are in private practice. We're out in the community. What does that look like? How do you collaborate when maybe the infrastructure is not there?
I'll have a little start if that's okay. There's a huge amount of opportunity, I should say. So, you're all here today in person. So if you're not collaborating today, now's a great opportunity. But if you are interested in thinking about informatics, I'll let Jackie talk about what the CSP can provide. But more broadly, there are professional bodies. If you think you are a clinician who is also a digital professional, you can join the Faculty of Clinical Informatics, which is part of the British Computer Society, that has a career structure to support the sorts of capabilities that you might be wanting to develop. You can sign yourself up to any of the courses that we have mentioned. So in particular, the face-to-face courses like the Digital Health Leadership Programme or the Topple Fellowship, one of the reasons they exist is to develop a real hothouse of a community that develops not only an opportunity to share ideas, but also trust. So, and actually there are plenty of regional, problem-specific, technology-specific, locality-specific networks. And joining things like your Digital Skills Development Network, actually you can't go too far wrong in finding people who've got similar interests.
Thank you. Nicola.
Thinking about the problems with technology when it's not working right, that's when we need to be changing how suppliers work with us, and that's where we're needing staff to come together to say this isn't working right for us. That's one of my areas of passion, is around making sure that the technology is working for us and is not slowing us down. And in Scotland, one of our suppliers of an electronic patient record is really changing the way that group of suppliers are working, because they want to make changes. So we've got a national steering group for this supplier where health boards or organisations are bringing any problems or ideas for developments to them, and those suppliers are making these changes. So it's not just here's your electronic patient record, that's what we've given you, that's what you've bought, you're on a however many year deal, that's it. This supplier is changing the way suppliers are starting to think, and that is really, really good, because we're then saying it's too slow or it's not very efficient this way, there's a better way of doing it, and those suppliers are taking up those ideas, and then staff feel that they're having that opportunity to provide that feedback and differences are being made. So I'd like to see more of that. We need staff to speak up when systems aren't working right for them.
Great, love that. We are at the red box. Jamie.
Hi, yeah. So I'm just picking up on the question around data and do we just measure waiting list data? And I was just thinking around, in the current context where resources is very limited, locally our business analyst resource is so limited. And I'm just wondering around what the role is of NHS England and commissioners in terms of changing KPIs away from waiting times towards clinical outcomes, clinical effectiveness, patient experience, away from waiting times. As from a senior leader perspective, when they've got that limited resource, they're likely going to prioritise that resource towards measuring waiting times, and that then limits the other things that we can measure, which we'd love to be able to measure.
Do you want to pick that up again?
Yes, please.
As an NHS England employee, although I don't think I'm personally responsible for all of the problem that you have just articulated. And also, if you don't mind, I'll speak really frankly. So I can't see a situation in the near future where you're not going to have key performance indicators from a national body. We've got, the National Health Service is publicly funded, and there are things that the taxpayer and the voter, importantly, tend to feel are important. So there will be a requirement for data. I totally recognise, by the way, that what you're saying is, if you ask for something over here and you've only got enough time and money and effort to answer one question, that's the thing you're going to answer. Fundamentally, however, we just need to find a way to, measure that, but measure it a lot cheaper and easier. There needs to be very little effort on measuring the thing that feeds the beast, and a very big effort on measuring the thing that matters to your patients, your users, which might be how long it takes them to see you, or it might be whether they get better, or it might be whether they've got nice magazines in the waiting area, or it might be not having to wait at all. It might be not having to see you at all. I don't know what it is. But the important thing about user-centered design is that you need to ask your users that, and you're not your user. And so we need to find a way of giving you the time and the resource and the expertise to enable you to do that, so that the key KPIs that you are measuring, that you're spending your time on, are focusing the efforts of you and your team on making things better for the people who you serve. I don't have an answer, but that's where we need to get to.
Not yet.
No. Okay, we have a question online, which I think is going to be for Jackie and potentially Ewan as well. So the delegate has asked, are the CSP signposting members to the existing e-learning Essentials of Digital Clinical Safety on the e-learning for health? Really important, we embed the culture of digital clinical safety.
I'm getting nods from you in that, yes, we are. Perfect. I'm getting nods from you in that, yes, we are, and that we've got. Was there a QR code on my slides? If you go onto our FIS digital resources, then it links to a lot of other clinical resources. We know there's a lot out there, so you'll go on there and you'll be able to find lots and lots of things that are available, free to use, that members can then access, link to through our website.
Any other questions while the box is coming to you? I wonder if I can pose another question, Chair's prerogative, around, I suppose, the point that's just been made around this economic argument. So as a profession, I think there's some concerns generally about the takeover, not necessarily of the robots, perhaps more automated processes. I know that there's been services that are being preferentially commissioned because they are supposed to be standalone digital products, and how that might impact the profession as a whole. But I suppose attached to that is this idea of, is there a role for the professional body to almost advocate of the quality control of some of those claims?
So yes, as a professional body, we are doing a piece of work on AI. It's some of the risks and some of the problems that Nicola and James alluded to earlier is that in the time that it takes to do some of this work, things are moving on. So we're going as quick as we can. We've got a working group looking into AI and looking into how that might affect the profession and to give you some guidelines and to give you some support. What we do want to do, one of my other professional advisor colleagues has a great quote, is we want AI and we want that technology to support you to do the things that you don't need to do as physios. Her quote, or I don't know if it was her quote or she took it from somebody, but she said, I don't want AI to write my art, to do my art or to write my poetry. I want it to do my laundry and I want it to wash my dishes. We want AI to be helping you as physios do all the things that you don't need to do. So to be in the background, doing all that business information analysis, making it cheaper to be able to get that data, to process that data. That's the skill of AI, and that's where we want you guys to be harnessing that, to free you up to use your clinical skills, to do the hands-on treatment, to be face-to-face or remotely with your patients, whatever it is that they want for your service. So that's where we see it for the profession, is helping you, taking away some of that administrative burden, taking away the things that take the time and take the effort, leaving you guys to use your skills as actual physios.
Thanks, Jackie.
Okay.
Not red
Yeah.
box person, lady.
So thank you very much. It's been a really interesting session. Just a really quick question. The resources that are there from NHS England and NHS Scotland around the self-assessment tool, do they have to be accessed through an NHS trust, or can you access that outside of a trust setting, and can people in England access the Scottish resources and vice versa?
Do you
Yeah, I'm sure you can get on Tower One. You just Google it.
Okay, so anybody can just Google them and use those self-assessment tools. It's not that your trust has had to buy in, or you have to access it through a trust login or anything.
The English one is limited.
Okay.
So it uses a platform called Digital Learning Solutions, which is only granted via an IT help desk, which is within an organisation. So it doesn't have to be an NHS organisation, but it does have to be an organisation that's in it. So all NHS organisations have got access. Many social care providers do through their local authority, and then only third sector with sort of special dispensation. But that is possible, but you just need to ask and we'll get you on. But it's not a Google search and you get on for the English product.
Yeah, no, that's really
I'm
helpful.
sure the Scotland one you'll be able to get onto it, but only so far. When you start going into training resources, the modules, you need to be on TURAS or TURAS learning
Because I
platform.
think I'm just aware, like sort of from a private practitioner point of view, or people working third sector, some of those digital skills are just as important in that sector, but we haven't always got the access through NHS settings to access them.
Yeah, and so we're aware, and it's an area of growth, shall we say.
Good point.
Very
though.
diplomatic. Red box holder.
Hello, I'm John Larner. I'm Associate Professor from the University of East Anglia. Another quick question, I think. Notes with great interest that the CSP would like these things to be taught at undergraduate level. Couldn't agree more. Given the mad experience that undergraduate level is and all the things we have to teach, is the CSP planning to look at items to put in the curriculum and structure of what you think should be taught at undergraduate level?
I will honestly say I'm not sure, and I can check with our education team. What I do know is if you want your university to have a talk on informatics, that the CSP and staff can come and provide that. We do that to some universities anyway. We've got resources, we've got talks ready. It will take about an hour of your time, probably better pitched at your third year students than your second or first year students. But if that's something that we can support with, then absolutely let us know. We love coming out to talk to students anyway, or talking online to students. So at the moment, it's something that we can support you guys with, and I think as things change within education and the accreditation processes change, it is something that comes in, but specifically what comes in, again, it's probably unlikely to be prescriptive, but, you know, making sure that informatics is covered is going to be something that will be in there.
And I suppose just to add to that, I think newly qualified staff coming into services are a wealth of information and how they access and think. That digital mindset is certainly a lot more prominent in some of the people that I've worked with, and I still don't understand what TikTok is. But right at the back there.
Hi, yeah, I don't understand what TikTok is either. So. No, I just found it really interesting. I thought it was really great, and some of the really interesting stuff around the impact of burnout compared to COVID. I thought that was really interesting just to see that and the scale of it. Just one of the points I kind of noticed across it is a lot of the interactions that we're having with staff, or you're kind of trying to have with staff, are very much staff coming to you, looking to get interested in something. And there's a kind of talk about the idea of culture changes. Do you think there's a need to develop and access staff who don't want to go to you and don't particularly want to engage with this? And is that something that you guys are thinking about, whether it's from an NHS perspective or from a CSP perspective? And how do we kind of bridge that gap for those staff who are maybe feeling left behind, or those students that feel that it's not something they feel comfortable, capable, confident in, and don't feel willing to put their hand up to say, I'll go on that course? I'm just wondering about how you guys are thinking about that. If you can fix that, that'd be great.
I'll start. Yes is the short answer. So the Topol review back in 2019 estimated that 90% of people need to develop digital skills within a 5 to 10 year period. Our learning needs analysis from the beginning of this year indicated that 98% of staff recognised in themselves the need to develop digital skills. This is very quickly going from being a minority to being a saturated 100% requirement, really, for people to have some level of digital skills. We know that there is a small but important minority of people who are terrified of technology and do not have a background in it. We know that it is more associated with the industry in which you work than other things like age, for instance, or highest educational attainment. Working in the NHS is more of an indicator of poor digital skills than your age. We also know that increasingly people are being asked to use digital technologies as part of their work, and people are using it as an excuse to leave the NHS. You know, that burnout stat that I was talking about, it has a result, and that result is people choose to leave the NHS. And if you've looked at the long-term workforce plan, we definitely can't afford that. You know, we cannot afford to be hemorrhaging staff because of the ways in which we're trying to improve things. That's not good. So yeah, we definitely want to do it, and we definitely want to support it. We've got a large investment coming up at the end of this year, which will be a deep investigation around digital and data confidence and competence, and how we use educators to support that in the local health and care organisations, because educators are going to be a really important lever to supporting people who've got really complex learning needs that are not just about digital education, but also about understanding English or basic numeracy skills. And we know that they're quite tightly linked. So yeah, we want to solve it. No, it's not easy, and we'll be publishing our results in the next 6 to 8 months, I expect. So I'd like to hear what you think when we get around to publishing it.
And I'll just quickly add to that, when we last implemented an electronic patient record for allied health professions, when it came to looking for super users, we also wanted people that were out there that didn't think their skills were very good, because we were saying if we can get it right for you, then you know that everyone will be able to do it. So that was a really good opportunity for staff to say, my skills aren't very good, so I'll become a super user to really upskill myself. Or did you get a yellow card?
I did get a yellow card, but Jackie can take this
just
one.
going to say there's some really practical things you can do as teams. So it's things like just having that digital conversation. If you're a leader or you're a manager, or just as a clinician, just having that digital conversation as part of your appraisal. So making it part of your personal development review, not as a way to say to people you don't have those skills, but including it as a way to say, we want you to have those skills, we want you to develop. So teams that have digital champions, sometimes it's less threatening, less scary to go to your peer and say, I can't do that, can you help me? And that can be anybody from, band 2 up to band 8. So have digital champions, have those peer support networks, open those doors and open those conversations about technology, about digital skills at any point that you can, and try and make it really unthreatening for people to be able to come to you and say, I can't do this, and then give them the time. Investing that time in them to do some of those digital skills competencies is then going to rewards exponentially when those people do have those skills and do start to use them as in practice. So yeah, a bit of time for long-term gain.
That's it. So thank you, everyone. Thanks to our speakers and our online audience, and thanks to you for coming in to what I think is quite a future-focused symposium to really get us thinking about how to be a little bit more digitally enabled. And I don't know what's next. I think, is there a digital, some kind of reception? Oh, there we go. Thanks, Jack.
And thank you to Dr. Jockey Willumby for an expertly chaired session. Agree, very much future focused. The immediate future is drinks reception in the exhibition hall, as well as those joining us for dinner later on. Thank you so much for this session, and to our expert speakers for a brilliant evening and finish. And so hopefully see you all later on the dance floor. Take care.